Well, good afternoon, everybody, and welcome back to the United Regional Chamber of Commerce's weekly update. We try to bring on some interesting guests and some subjects, help educate the public a little bit. And today we have a returning guest. Her name is Cynthia Sierra. She is the head honcho CEO of the Manet Community Health that has opened up in downtown Attleboro. They've had many locations, and they do an awful lot for the community. So, Cynthia, welcome back.
Thank you. Thank you so much for having me. It's good to be back, probably 15 months later, Jack, from the first time that I came on. So thank you.
A lot of progress. I happened to be by your space this morning because I had a meeting in the building, and I saw the guys doing an awful lot of work, getting ready to expand.
Absolutely. And I'm glad you were able to stop by and appreciate 8 North Main Street. We're in very good company there. It's been a wonderful home for us. And yes, in fact, really pleased to be able to report on behalf of this team that we are indeed expanding. Jack, we have just 4 exam rooms, and we found that's just not enough. And so the other side of the lobby at 8 North Main Street, we will be breaking ground on expansion space, and we'll have up to 7 new exam rooms. We'll have consult spaces for services like mental health counseling, diabetic nurse case management, and all sorts of recovery services, navigation services, enabling services, if you will. So we very much look forward to the expansion ahead, but truly, truly grateful for the community that have helped to welcome us and the patients that are terrifically trusting us with their care, Jack.
Well, you're a great asset to the city of Attleboro. But let's take a step back for a minute. Let's tell us a little bit about you. Tell us about Cynthia.
Oh, sure. Happy to do that. I have the privilege and frankly the honor of leading a remarkable team here at the health center. It's a wonderful time post-pandemic for all of us to be strategic planning, to be visioning, to be looking ahead in terms of personally bring to it, I hope, a sense of both primary care, knowledge and enthusiasm, sort of outpatient and ambulatory medicine, but also come with clinical and in education and clinical psychology. So I'm hoping to my role, there's that ability to humbly serve the organization and the community, both from sort of that healthcare administrator perspective, but also as someone that saw patients for many, many years early on in my career. So hopefully coupling them together is hopefully helpful for the team and for our community partners. And I guess I would say that I absolutely love what I do. I think there is such tremendous value in community health centers and this opportunity to make sure that there's expanded access and unfettered access to primary care and integrated behavioral health services. So just pleased and proud to be a part of all this.
Well, you have an awesome staff. I've actually gone there. I had my booster shots done. I only cried a little bit, but they were very good. They're super friendly. Very informative, let me know everything that was going on beforehand. And I actually had to go back because one of the questions I have, I was going to bring it up a little later, but I understand that you're going to be having a flu clinic and another COVID booster shots available there in Attleboro.
Absolutely, Jack, and thank you for coming to see us, and thank you for bringing your courage, because vaccines aren't easy for everyone, truly not. We actually have some terrific news. We made a commitment to the community that we continue to assess what those needs are, including needs around hours of operation. And so with our 1-year anniversary, we opened on Monday evenings until 8 o'clock. So we're open Monday through Friday and our evening session on Monday, but we're also opening a COVID vaccination service on Monday evenings as well to help accommodate folks that are working during the day. They have caretaking issues, if you will, childcare, elder care. And so come and see us on on a Monday night. And yes, we have access to all of the vaccines. And so from sort of the youngest of us to our seniors and our elders, we're truly there to serve. And Jack, I don't want to get ahead of the year, but I think for us next, by next spring, let's say that we anticipate along with our expanded space there at 8 North Main Street, also our first Saturday session. So it's our commitment to the community that we're open and available as much as possible. And, bringing a new practice in Attleboro, if you will, from sort of infancy to toddlerhood to latency, you see the need to open up more access and more sessions. And so soon enough, that commitment to the community, and we'll be open on Saturdays as well, and provide that opportunity for same day care, but also vaccination service. So I'm glad. I hope you come and see us all the time, Jack.
Well, no offense, but I don't really want to be in a health center all the time if I don't have to. But let's jump on that for a minute. What do you have to call to make an appointment now to get your vaccine?
Yes, we prefer calls. We do accommodate walk-in. So for folks that are able to give us a call, and that allows us to just do sort of some of that back office scheduling in advance. It makes, if you will, the workflow more efficient. So we're at 508-205 4600, 508-205-4600, manetchc.org. But know that you will not be turned away if you walk in. It just gives us, again, that kickstart to make sure that you're having the most efficient experience possible with us.
And only beyond my knowledge, but you accept all insurance plans?
Indeed, we do. Absolutely. Yes, we certainly do. From those traditional commercial plans to Point 32, which is at Harvard Pilgrim Healthcare, Tufts combination, Blue Cross Blue Shield, Aetna, United. There's very few plans that we're not contracted with. We're also a Mass Health, a Medicaid provider, a state health safety net provider, and serve patients, Jack, that frankly, from newborn to post-centenarian, have patients that are 105 years young. So any age, consider us, if you will, coverage and insurance agnostic, and we will work to help support your completion of coverage if you're eligible for a particular plan, but you just may not know how to navigate, if you will, through sort of the maze of some of our coverage plans and those opportunities.
Okay, now a different question. What should they not come to the clinic to get treated, such as a broken bone or something like that?
Yeah, absolutely. That's an excellent question. Where do you go for what, if you will, services can be provided inside of a health center? Where would you want to perhaps bypass a health center or primary care, same day urgent care, and go to the emergency department? So if there are, cardiac conditions, there's questions of a live cardiac event. There's questions of a stroke event, a vascular accident, if you will. Manet Attleboro does not have present day access to X-rays, if you will, plain film, right? So significant injuries that you could present to a health center or primary care, but you would need to be, if you will, transitioned to, expedited to sturdy emergency department, as an example. The majority of what our loved ones, our family members, our friends experience, headaches, chronic diseases, behavioral health circumstances, questions around wellness, questions around COVID, respiratory conditions, injuries, abrasions, if you will, can be taken care of within our health center in Attleboro, and within community health centers. It's an excellent question. Jack.
Okay, well, you are not just located in Attleboro. Tell us about some of the other locations you have.
Absolutely. I will say, though, our top 10 list of zip codes, breaking news here, Attleboro has made the top 10.
Oh,
And yeah, in terms of, which is wonderful for us to see where our patients, if you will, live their lives. So, but correct, absolutely. Manet was established in 1979 by community residents in the city of Quincy. And we joined, if you will, the ranks of federally qualified health centers across the country that serve right about 30 million patients. So 1 in 7 Massachusetts residents, 1 in 7 receive their care at one of the community health centers across the Commonwealth. So we opened in Quincy. We have 3 locations in Quincy. We have a location in Hull. Folks may think about Hull in terms of the formerly known as Paragon Park,
yes.
right?
That goes back a couple of years, those. Yeah.
Yeah, absolutely. And they still have the carousel. It's a wonderful testament to that time and Hull's history. Hull's important in terms of access to primary care in an isolated, if you will, area of the South Shore. We opened in Taunton in 2014. We continue to grow in Taunton. It's about 22% of our organizational volume is in Taunton. We have had tremendous expansion there. We'll continue to expand there. Some Taunton patients receive their care at Manet Attleboro because they live on that side of Taunton, that it's actually more convenient for them to come to Attleboro. And then in Attleboro, and 2 new opportunities next year. Jack, thank you for the question. We're opening a school-based health center on the central campus of Taunton Public Schools on William Street. So September 2023, we will have our 7th health center site inside of the Taunton, again, the central grounds where there's Taunton High School, the Taunton Welcome Center, and the Parker Middle School. So we're delighted. That's where care can really, really happen. And that's a combination of primary care and behavioral health. We're also opening up a health center, Jack, inside of Father Bill's in Mainspring, which is a homelessness prevention organization and sheltering organization. They're opening up a brand new housing resource center, which will have acute, if you will, emergency beds and transitional units and apartments. And we're really honored that late next spring, 2023, you will see a Manet door and a Manet logo and Manet staff inside of Father Bill's in Mainspring in their new Yawkey Housing Resource Center. So we take their lead and in terms of the timeline, but anticipating late spring 2023. So the expanding, if you will, that breadth and depth of what this amazing team does to bring the service into the schools and to bring it closer to our homeless community, just terrifically important for us, Jack. Thank you for the question. As we grow in Attleboro as a significant priority for us, we're also growing, if you will, across the health center.
Well, you've been such an asset to the city of Attleboro, and I know the other locations. I've been to a couple of them just to view them. You make sure you put them in very convenient places for people to get good access and easy to get in to see your folks. You've got a tremendous staff, friendly, professional. That you have the knowledge needed for both the physical and the mental health issues that a lot of folks deal with. And we're really appreciative that you opened up here in Attleboro. So, Cynthia, we're winding down a little bit here. Any final thoughts for our viewers today?
I guess it's to humbly say to you, Jack, thank you for what you do. We know that our services are growing, not only word of mouth and, if you will, reputational influence. And so every exchange, every patient that we take care of, every community resident that trusts us, whether it's a vaccine, it's a test, it's a physical exam, it's an appointment with a nutritionist, with a care manager, a behavioral health appointment, that's what's helping to spread the mission and to spread the message that we have unfettered access with a wonderful team that includes Dr. Jessica Bradford and Charlotte Hines and Haley. Her last name was Irwin. Haley Samtarpio, and she recently was as a local proud Attleboro resident working with our terrific schools, and we're here in service to the Attleboro Public Schools as well. So thank you. Without the mayor's support, of course, Congressman Auchinclosh's support, Jack, your support, you took me around when I didn't know where we should land, and showed me the sights and sounds. And so in Sturdy Memorial, just a terrific community partner. We can't say enough. Was pleased to be with them at Just for the Health of It over the weekend. So thank you. Our honor and privilege to serve. Thank you.
Well, thank you very much for coming on the show today. We hope some folks got some very important information, that you're there, you're available to the community. You will be expanding your hours and you'll be expanding your space very shortly. So Cynthia, once again, thank you for coming on the show. Shout out again to Dave Angel, our producer, and AACS team over there to put up with me each week. And folks, we'll see you next week. Everybody, please stay safe.